The monitor itself, when you're looking at a monitor, the biggest part that you're going to see on almost any screen is the heart rate, right? And when you look at the heart rate, that's the biggest on the monitor for a reason, because it just happens to be probably the most important piece of information on the monitor. Changes to that heart rate, right, is a day-to-day, moment-to-moment, calibration about how the patient is doing. When you're thinking about what drives a heart rate, it's usually, you need more energy. And because you need more energy, then the combination of usually the amount of adrenaline in your body and maybe some vagal tone together will give you a heart rate that you're feeling right now. So you're out and it's like, I need to walk, and it hurts to walk because I'm post-operative. Right? You're going to find that the heart rate picks up, and that's what it's supposed to do. So when someone looks at a monitor and thinks that the strips themselves, right, the whether or not the P wave, what the shape and things like that is the most important thing on the monitor, or they start by reading a rhythm and they start with a P wave, like it's the most important thing on the monitor, and then I'm going to get to the QRS, and then eventually I'm going to get the heart rate. That is a pretty common thing, and it's not wrong, right? It is right, but it's insufficient to protect your patient. You need to actually be able to look at heart rate and put the priority up there. So let's say I get a person up, just fresh post-op, and I'm looking at the monitor right there, all right? And I'm sitting them up, and it's still sinus rhythm. It's beautiful, sinus rhythm. But I'm expecting that when I'm sitting them up, because they've got a pillow and they're holding on and they're trying to hold everything together, and they got a fresh incision that's all stitched or stapled, but it hurts, all right? And I look at that monitor and it does not change at all. That is not expected, all right? And if I don't recognize that and stop doing what I'm doing right now, all right, we can have some real trouble, because that person's blood flow should be increasing to meet the extra energy that they're doing, and the pain. And if I'm saying their heart is not responding, that means that as I start to stand them up, they may not have the blood flow to deal with that, and they may just start to pass out, and we've got complications that I was being told by looking at the heart rate, if I have the eyes to see. So if there's one thing to be thinking about when it comes to the monitor, you want to really think in this, what's that heart rate doing? That's the number one thing. And does it fit what's going on with the person? And if it does, great. But if it does not, we really want to take a little bit of moment. What's going on? Is there something else? And then a friend of mine, or I think like this, and I think, oh wait, but they're on beta blockers. Okay. Maybe that's why their heart rate's not responding as fast, because the beta blocker is keeping that epinephrine, the adrenaline at bay. Right? It's but that doesn't make it okay. That means I'm going to take a little bit more time and slow it up as to maybe having them stand if they're actually not able to respond, like maybe you or I are. So monitor, if there's the number one mistake, I think if there's a mistake, it would be thinking that, the rhythm itself, still the same name, we're good. And it's that's not enough, right? Of everything that we see of people on the monitor, it's because we want to be able to calibrate what's going on with the heart rate and what's going on with them.